Question 1. The control framework reveals that a patient presents for a follow-up appointment reporting new onset of blurred vision and mild eye redness, stating they started a new prescribed ocular medication 2 days ago. What is the most appropriate course of action for the Certified Paraoptometric Technician, CPT? Option A. Advise the patient to continue taking the new medication as prescribed and monitor their symptoms. Option B. Instruct the patient to discontinue the new medication immediately until their next scheduled appointment. Option C. Recommend the patient use over-the-counter artificial tears and a cool compress to alleviate the redness and blurred vision. Option D. Document the patient's reported symptoms and immediately inform the supervising optometrist for further evaluation and management. The correct answer is D. Document the patient's reported symptoms and immediately inform the supervising optometrist for further evaluation and management. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the paraoptometric technician to interpret a patient's reported symptoms in the context of their prescribed ocular medication. Misinterpreting the symptoms or the medication's effects could lead to incorrect advice, potentially delaying proper medical intervention or causing patient harm. The technician must balance providing helpful information with understanding the boundaries of their professional scope of practice, especially when dealing with potential adverse reactions. Correct approach analysis. The correct approach involves recognizing that the patient's reported symptoms could be indicative of a side effect or an adverse reaction to the prescribed medication. The paraoptometric technician's responsibility, as outlined by CPT guidelines, is to accurately document the patient's complaint and then escalate the situation to the supervising optometrist. This ensures that a qualified medical professional can assess the situation, determine the cause of the symptoms, and adjust the treatment plan if necessary. This aligns with the ethical obligation to act in the patient's best interest and within the scope of practice, which prohibits independent diagnosis or treatment modification. Incorrect approaches analysis. Advising the patient to simply continue the medication without further consultation is a significant ethical and regulatory failure. This approach bypasses the supervising optometrist's role in patient care and could lead to the patient experiencing worsening side effects or an untreated adverse reaction. Constitutes practicing outside the defined scope of a paraoptometric technician. Suggesting the patient stop the medication immediately without consulting the optometrist is also a failure. While the symptoms might be related to the medication, abruptly discontinuing certain ocular medications can have its own adverse consequences or lead to a relapse of the underlying condition. This action constitutes unauthorized modification of a prescribed treatment plan, which is beyond the paraoptometric technician's authority. Recommending over-the-counter remedies for the reported symptoms without understanding their potential interaction with the prescribed ocular medication is another failure. This could mask symptoms, interfere with the efficacy of the prescribed medication, or even exacerbate the patient's condition. It also represents an attempt to diagnose and treat independently, which is outside the scope of practice. Professional reasoning. When faced with a patient reporting new or concerning symptoms after starting an ocular medication, a paraoptometric technician should follow a structured decision-making process. First, listen carefully and document the patient's reported symptoms accurately. Second, consider the patient's current medication regimen and any known side effects of the prescribed drug. Third, recognize the limitations of their role and the necessity of involving the supervising optometrist for diagnosis and treatment adjustments. Finally, communicate the patient's concerns clearly and concisely to the optometrist, allowing for appropriate medical management. Question 2. Process analysis reveals a patient presenting with a chief complaint of sudden onset blurred vision and discomfort in one eye. During the examination, the certified paraoptometric technician, CPT, observes significant corneal edema, a possible epithelial defect, and notes the patient's report of photophobia. Considering the CPT's role within the regulatory framework, which of the following actions best represents the appropriate professional response? Option A. Focus solely on documenting the objective findings of corneal edema and epithelial defect, as these are the most visually apparent indicators of a problem. Option B. Inform the patient that they likely have a corneal ulcer and advise them to use over-the-counter lubricating drops until they can see the optometrist. Option C. Document all observed signs and symptoms, including the patient's subjective complaints and objective findings, and present this comprehensive information to the supervising optometrist for diagnosis and treatment planning. Option D. Proceed to perform a corneal scraping and culture without explicit instruction from the supervising optometrist to gather more diagnostic data. The correct answer is C. Document all observed signs and symptoms, including the patient's subjective complaints and objective findings, and present this comprehensive information to the supervising optometrist for diagnosis and treatment planning. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified paraoptometric technician, CPT, to interpret and act upon diagnostic information related to a potentially serious corneal condition. The CPT must balance the need for accurate data collection and patient care with the limitations of their scope of practice. Misinterpreting findings or overstepping professional boundaries could lead to delayed or incorrect treatment, patient harm, and regulatory violations. The CPT's role is to support the optometrist, not to diagnose or prescribe independently. Correct approach analysis. The correct approach involves meticulously documenting all observed signs and symptoms related to the patient's corneal concerns, including visual acuity, subjective complaints, and objective findings from examination. This documentation should be thorough and precise, using appropriate ophthalmic terminology. The CPT must then present this comprehensive information to the supervising optometrist in a clear and organized manner, allowing the optometrist to make the diagnosis and treatment plan. This adheres to the CPT's scope of practice, which emphasizes data collection and patient support under optometrist supervision, as outlined by the relevant U.S. state or national optometric board regulations governing CPTs, e.g., American Optometric Association, AOA, guidelines or specific state board of optometry regulations. Ethical practice dictates that the CPT acts as an extension of the optometrist, providing essential information for informed clinical decision-making. Incorrect approaches analysis. One incorrect approach involves the CPT attempting to provide a preliminary diagnosis to the patient based on their observations. This is a direct violation of the CPT's scope of practice, as diagnosis is the exclusive domain of the licensed optometrist. Such an action could lead to patient anxiety, misinformation, and potentially inappropriate self-treatment, contravening regulations that define the boundaries of paraoptometric practice. Another incorrect approach is to dismiss the patient's subjective complaints and only document objective findings that seem significant to the CPT. This fails to capture the full clinical picture and can lead to incomplete information being presented to the optometrist. Patient-reported symptoms are crucial diagnostic clues, and their omission represents a failure in thorough data collection, which is a core responsibility of the CPT. This also undermines the collaborative nature of patient care and could be seen as a breach of professional diligence. A third incorrect approach is to perform additional, unordered diagnostic tests without explicit instruction from the supervising optometrist. While a CPT may be trained in various diagnostic procedures, performing them outside the optometrist's directive can lead to unnecessary costs, patient discomfort, and the generation of data that may not be relevant to the optometrist's diagnostic pathway. This oversteps the CPT's authorized duties and can interfere with the optometrist's clinical judgment. Professional reasoning. Professionals should approach such situations by first understanding their defined scope of practice and the specific regulations governing their role. When presented with a patient exhibiting signs or symptoms of a potential corneal issue, the professional decision-making process involves 1. Actively listening to and documenting the patient's subjective complaints. 2. Performing all ordered and relevant diagnostic tests with precision and accuracy. 3. Meticulously recording all objective findings. 4. Clearly and concisely communicating all gathered information to the supervising optometrist. 5. Awaiting the optometrist's diagnosis and treatment plan before any further patient communication or action beyond basic supportive care. This systematic approach ensures patient safety, regulatory compliance, and effective team-based eye care. Question 3. Comparative studies suggest that early detection of choroidal melanomas significantly impacts patient prognosis. A certified paraoptometric technician, CPT, performing a routine examination, notes a suspicious pigmented lesion in the choroid during fundus examination, which appears to have irregular borders and slight elevation. The patient reports no subjective visual changes. Considering the CPT's scope of practice and the need for prompt, appropriate action, which of the following represents the most appropriate risk assessment and management approach? Option A. Advise the patient that the lesion is likely a common nevus and suggest they return in a year for a routine checkup, focusing on other aspects of the eye exam. Option B. Attempt to measure the lesion's dimensions using the slit lamp biomicroscope and provide the patient with a referral to a general practitioner for a second opinion. Option C. Reassure the patient that the lesion appears benign and advise them to monitor for any changes in vision, scheduling a follow-up appointment in 6 months. Option D. Document the lesion's characteristics, including its location, size estimation, and appearance, and immediately report these findings to the supervising optometrist or ophthalmologist for further evaluation and management. The correct answer is D. Document the lesion's characteristics, including its location, size estimation, and appearance, and immediately report these findings to the supervising optometrist or ophthalmologist for further evaluation and management. Explanation. This scenario presents a professional challenge because it requires a paraoptometric technician to interpret and act upon information related to a potentially serious ocular condition, choroidal melanoma, while adhering strictly to the scope of practice and regulatory guidelines for a certified paraoptometric technician, CPT, in the United States. The technician must recognize the limitations of their role and ensure that diagnostic and treatment decisions are made by the licensed optometrist or ophthalmologist. The risk assessment approach is crucial here to identify potential dangers to the patient's vision and overall health, and to ensure appropriate referral and communication. The correct approach involves recognizing the signs and symptoms suggestive of a choroidal melanoma, documenting these findings accurately, and immediately communicating them to the supervising licensed eye care professional. This aligns with the CPT's responsibility to assist in patient care and to report observations that may impact diagnosis and treatment. The ethical and regulatory framework for CPTs emphasizes patient safety and the importance of working within one's defined scope of practice. Prompt and accurate reporting ensures that the patient receives timely and appropriate medical evaluation and management by a qualified practitioner, thereby minimizing potential harm and upholding the standard of care. An incorrect approach would be to attempt to diagnose or reassure the patient about the observed findings. This constitutes practicing optometry or medicine without a license, which is a direct violation of state and federal laws governing healthcare professionals. Another incorrect approach would be to delay reporting the findings, which could lead to a delay in diagnosis and treatment, potentially worsening the prognosis for the patient and constituting negligence. Failing to document the findings accurately or comprehensively would also be a professional failure, hindering the supervising practitioner's ability to assess the situation and potentially leading to miscommunication or misinformation. Professionals should employ a systematic risk assessment process when encountering any unusual or concerning findings. This involves 1. Identifying the potential risk, e.g., a serious ocular pathology. 2. Assessing the severity and likelihood of harm. 3. Determining the appropriate immediate action within the scope of practice, e.g., documentation and reporting. And 4. Ensuring clear and timely communication with the supervising licensed practitioner. This structured approach ensures that patient safety is prioritized and that all actions are compliant with regulatory requirements and ethical standards. Question 4. The monitoring system demonstrates that a patient diagnosed with moderate non-proliferative diabetic retinopathy has missed their last 3 scheduled follow-up appointments, and the technician has noted the patient has not been returning calls regarding rescheduling. The technician is aware that the patient's primary caregiver is their adult child, who has previously expressed significant concern about the patient's vision. What is the most appropriate and ethical course of action for the paraoptometric technician in this situation? Option A. Document the missed appointments and lack of response in the patient's chart and inform the supervising optometrist of the situation. Option B. Contact the patient's adult child directly to inform them of the missed appointments and express concern about the patient's follow-up care. Option C. Advise the patient to seek immediate emergency care, assuming the worst-case scenario for their diabetic retinopathy. Option D. Make a note in the patient's chart that no further action is required, as the patient is an adult and responsible for their own care. The correct answer is A. Document the missed appointments and lack of response in the patient's chart and inform the supervising optometrist of the situation. Explanation. This scenario presents a professional challenge because it requires the paraoptometric technician to balance patient privacy with the need to ensure appropriate care and follow-up for a potentially serious condition. The technician has observed a pattern of missed appointments and incomplete follow-up care related to a diagnosed condition that could lead to vision loss. The ethical dilemma lies in how to address this without violating patient confidentiality or overstepping professional boundaries. Careful judgment is required to determine the most appropriate and ethical course of action. The correct approach involves documenting the observations and concerns accurately, and then discussing them with the supervising optometrist or ophthalmologist. This upholds professional responsibility by ensuring that a potentially sight-threatening condition is being managed appropriately, while respecting patient autonomy and privacy. The supervising clinician is then empowered to address the situation directly with the patient, utilizing their established patient-provider relationship and clinical judgment. This aligns with ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as professional guidelines that emphasize collaboration and communication within the healthcare team. An incorrect approach would be to directly contact the patient's family member without the patient's explicit consent. This violates patient privacy and confidentiality, which are paramount in healthcare settings. Such an action could erode patient trust and potentially lead to legal repercussions. Another incorrect approach would be to ignore the observed pattern and do nothing. This fails to act in the patient's best interest and could be considered a breach of professional duty, especially if the condition is progressive and requires timely intervention. Failing to document the observations also represents a failure in professional practice, as it removes the ability for the supervising clinician to be informed of potential issues. Professionals should approach such situations by first recognizing the ethical considerations involved, particularly patient confidentiality and the duty of care. The decision-making process should involve 1. Objectively observing and documenting the facts. 2. Assessing the potential risks to the patient's health if the situation is not addressed. 3. Consulting with the supervising clinician to discuss concerns and explore appropriate next steps. 4. Acting in accordance with established protocols and ethical guidelines, prioritizing patient well-being while respecting privacy. Question 5. Investigation of a patient's visual complaint reveals a need to assess how light is affected by their optical system. The patient reports difficulty with distance vision and experiences some visual distortion. The paraoptometric technician is tasked with evaluating the impact of the patient's refractive error and any potential binocular vision anomalies. Considering the principles of light, reflection, refraction, and the properties of lenses and prisms, which of the following approaches best demonstrates the technician's understanding and application of these concepts in a clinical setting? Option A. Assume that all visual distortions are due to aberrations of the eye's surface and do not consider the role of lenses or prisms in modifying light. Option B. Focus only on the patient's subjective description of visual distortion and disregard any objective measurements of visual acuity or refractive error. Option C. Systematically assess the patient's visual acuity at distance and near, then evaluate the effect of a trial lens, specifically a concave lens, on the clarity of vision, and observe how a prism, if present in the patient's prescription or during testing, deviates the image based on its orientation. Option D. Immediately prescribe a specific power of glasses based on the patient's reported symptoms without performing any objective or subjective testing. The correct answer is C. Systematically assess the patient's visual acuity at distance and near, then evaluate the effect of a trial lens, specifically a concave lens, on the clarity of vision, and observe how a prism, if present in the patient's prescription or during testing, deviates the image based on its orientation. Explanation. This scenario is professionally challenging because it requires a paraoptometric technician to apply fundamental principles of light to a practical patient care situation, ensuring patient safety and accurate diagnostic information. The technician must understand how light interacts with optical elements to correctly interpret visual findings and potential optical corrections. Careful judgment is required to select the most appropriate method for assessing visual function and to communicate findings effectively to the supervising optometrist. The correct approach involves a systematic evaluation of how light behaves when passing through the patient's optical system, considering the effects of lenses and prisms. This aligns with the CPT's responsibility to assist in the examination and management of patients by understanding optical principles. Specifically, recognizing how a concave lens diverges light and how a prism deviates light based on its apex and base is crucial for accurate assessment of refractive error and binocular vision. This understanding is foundational to the paraoptometric's role in gathering objective and subjective data that informs the optometrist's diagnosis and treatment plan, adhering to the scope of practice defined by regulatory bodies governing paraoptometric technicians. An incorrect approach that focuses solely on the patient's subjective complaint, without considering the underlying optical principles, would be professionally unacceptable. This fails to leverage the technician's specialized knowledge and could lead to incomplete or misleading information being provided to the optometrist. Another incorrect approach, such as assuming a specific lens power without performing the necessary tests, bypasses the diagnostic process and violates ethical standards of care by not conducting a thorough examination. Furthermore, misinterpreting the effect of a prism, for example, by incorrectly identifying its base or apex and thus its direction of light deviation, would lead to inaccurate findings and potentially inappropriate recommendations, undermining the integrity of the patient's examination and the optometrist's clinical decision-making. Professional reasoning in such situations requires a systematic approach. First, identify the patient's chief complaint and any relevant history. Second, apply knowledge of optical principles, such as reflection, refraction, and the behavior of lenses and prisms, to hypothesize potential causes. Third, select and perform appropriate diagnostic tests that utilize these principles to gather objective data. Fourth, accurately interpret the results of these tests in the context of the patient's symptoms and the known behavior of light and optical elements. Finally, communicate findings clearly and concisely to the supervising optometrist, highlighting any observations that relate to the principles of light and optics. Question 6. Cost-benefit analysis shows that early detection and management of glaucoma significantly reduce the long-term costs associated with vision loss and disability. A certified paraoptometric technician, CPT, is performing a routine eye examination and notes the following. Intraocular pressure IOP is 24 mmHg in the right eye and 22 mmHg in the left eye. During gonioscopy, anterior chamber angle appears narrow in the superior quadrant of both eyes, with only the scleral spur visible. The patient reports no current symptoms. Which of the following approaches best reflects the CPT's role in risk assessment for glaucoma in this scenario? Option A. Document the IOP readings and gonioscopy findings, noting the narrow angles, and alert the supervising optometrist to these findings for further evaluation. Option B. Advise the patient that their IOP is slightly elevated and they likely have early-stage glaucoma, recommending they schedule a follow-up appointment specifically for glaucoma management. Option C. Focus solely on the IOP readings, as they are the primary indicator of glaucoma, and inform the optometrist that the IOP is borderline elevated. Option D. Record the IOP and gonioscopy findings, but consider them within normal limits given the absence of patient symptoms, and proceed with the rest of the examination. The correct answer is A. Document the IOP readings and gonioscopy findings, noting the narrow angles, and alert the supervising optometrist to these findings for further evaluation. Explanation. This scenario is professionally challenging because it requires a paraoptometric technician to interpret clinical findings related to glaucoma, a serious condition that can lead to irreversible vision loss. The technician must understand the complex interplay between aqueous humor production and drainage, the anatomy of the anterior chamber angle, and the various types and pathophysiological mechanisms of glaucoma. The risk assessment approach is crucial here, as it involves evaluating the potential for vision loss and the need for timely intervention. The technician's role is to gather and present accurate information to the supervising optometrist, ensuring that appropriate management decisions can be made. The correct approach involves accurately assessing the patient's anterior chamber angle and intraocular pressure, IOP, findings, recognizing potential signs of glaucoma, and documenting these findings meticulously for the optometrist. This aligns with the CPT's scope of practice, which includes assisting in the diagnosis and management of ocular conditions. Regulatory frameworks for paraoptometrics emphasize the importance of accurate data collection and reporting to support the optometrist's diagnostic and treatment decisions. Ethical guidelines also mandate that technicians act in the best interest of the patient, which includes identifying potential sight-threatening conditions. An incorrect approach would be to dismiss subtle findings or to make a definitive diagnosis of glaucoma. Dismissing subtle findings fails to uphold the duty of care and could delay necessary treatment, leading to progressive vision loss. Making a definitive diagnosis exceeds the paraoptometric technician's scope of practice, which is to assist, not to diagnose independently. Another incorrect approach would be to focus solely on IOP without considering the anterior chamber angle anatomy, as some forms of glaucoma are angle closure related and require specific assessment of the angle. This incomplete assessment could lead to misinterpretation of the risk. Professional decision-making in such situations requires a systematic approach. First, accurately perform and record all relevant measurements and observations, e.g., gonioscopy findings, IOP readings. Second, correlate these findings with the patient's history and other clinical data. Third, present this comprehensive information clearly and concisely to the supervising optometrist. Finally, be prepared to answer the optometrist's questions and assist with further diagnostic steps as directed. This process ensures that all available information is considered, leading to the most appropriate patient care. Question 7. The performance metrics show a consistent pattern of patients reporting ocular discomfort and fluctuating vision, particularly in the morning and after prolonged screen use. When evaluating these patients, what is the most comprehensive approach for a certified paraoptometric technician, CPT, to assess potential lacrimal system dysfunction? Option A. Document the patient's reported symptoms and recommend they schedule a follow-up appointment with an ophthalmologist for a specialized lacrimal system evaluation. Option B. Focus solely on examining the puncta and canaliculi for any visible blockages, assuming any discomfort is due to drainage issues. Option C. Advise the patient that these symptoms are common with digital device use and suggest over-the-counter artificial tears without further clinical investigation. Option D. Inquire about the patient's symptoms, perform a Skirmer's test to measure basal tear production, and assess the tear breakup time to evaluate tear film stability. The correct answer is D. Inquire about the patient's symptoms, perform a Skirmer's test to measure basal tear production, and assess the tear breakup time to evaluate tear film stability. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a paraoptometric technician to interpret subjective patient-reported symptoms in the context of objective clinical findings related to the lacrimal system. The technician must differentiate between normal physiological variations and signs of a pathological condition, such as dry eye disease, which can significantly impact patient comfort and vision. Accurate assessment is crucial for appropriate patient management and referral. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's reported symptoms, correlating them with objective clinical signs observed during the examination, and considering the known anatomy and function of the lacrimal system. This aligns with the CPT's scope of practice, which includes assisting the optometrist in diagnosing and managing ocular conditions. Specifically, understanding tear film dynamics, tear production mechanisms, basal, reflex, and drainage pathways, puncta, canaliculi, lacrimal sac, nasolacrimal duct, is fundamental. The CPT must recognize how disruptions in these areas can manifest as dry eye symptoms. Regulatory frameworks for paraoptometric technicians emphasize the importance of accurate data collection and observation to support the optometrist's diagnosis, ensuring patient safety and effective care. Incorrect approaches analysis. An approach that solely relies on patient self-diagnosis without objective clinical correlation is professionally unacceptable. This fails to uphold the CPT's responsibility to gather and interpret clinical data, potentially leading to misdiagnosis or delayed treatment. It bypasses the structured diagnostic process mandated by professional standards. An approach that dismisses patient symptoms as insignificant without a thorough clinical investigation of the lacrimal system is also professionally flawed. This demonstrates a lack of patient-centered care and a failure to recognize that subjective complaints often signal underlying ocular issues that require investigation. It neglects the comprehensive assessment expected of a CPT. An approach that focuses exclusively on one aspect of the lacrimal system, such as only tear production, while ignoring tear drainage or the tear film stability, is incomplete. This demonstrates a superficial understanding of the lacrimal system's integrated function and can lead to an inaccurate assessment of dry eye disease, which often involves multiple components of the system. Professional reasoning. When faced with a patient reporting symptoms suggestive of lacrimal system dysfunction, a paraoptometric technician should employ a structured, evidence-based approach. This involves 1. Actively listening to and documenting the patient's chief complaint and associated symptoms. 2. Performing a comprehensive ocular examination, including specific tests relevant to the lacrimal system, e.g., tear breakup time, Skirmer's test, fluorescein staining for punctate epithelial erosions, assessment of lid margins and meibomian glands. 3. Correlating subjective symptoms with objective findings, considering the known anatomy and physiology of tear production, tear film composition, and tear drainage. 4. Communicating findings clearly to the supervising optometrist for diagnosis and treatment planning. This systematic process ensures that patient care is grounded in clinical evidence and professional standards. Question 8. The review process indicates a patient, new to contact lens wear, has been prescribed rigid gas permeable (RGP) lenses. The paraoptometric technician is responsible for educating the patient on the proper care and handling of these lenses. Which of the following approaches best ensures patient safety and compliance with professional standards for contact lens education? Option A. Instruct the patient to use multipurpose solutions designed for soft contact lenses, as they are generally safe and convenient for all lens types. Option B. Provide the patient with a general pamphlet on contact lens care and ask if they have any immediate questions. Option C. Explain the specific cleaning, disinfection, and storage procedures for RGP lenses, emphasizing the importance of using approved solutions and adhering to the prescribed wear schedule, while also verifying the patient's understanding through demonstration and questioning. Option D. Advise the patient to research contact lens care online and follow the instructions provided by the lens manufacturer, as the technician is not a licensed optometrist. Correct answer is B. Provide the patient with a general pamphlet on contact lens care and ask if they have any immediate questions. Explanation. This scenario presents a professional challenge because a paraoptometric technician is tasked with educating a patient on contact lens care, a critical aspect of ocular health that directly impacts patient safety and the success of lens wear. Misinformation or incomplete guidance can lead to serious complications, including infections, corneal ulcers, and vision loss. The technician must possess a thorough understanding of different contact lens types, their specific care requirements, and potential risks, all while adhering to established professional standards and regulatory guidelines for patient education. The correct approach involves providing comprehensive, individualized education based on the specific type of contact lens prescribed and the patient's lifestyle, emphasizing proper cleaning, disinfection, storage, and wear schedules. This aligns with the ethical responsibility to ensure patient understanding and promote safe practices, as mandated by professional standards that require technicians to deliver accurate and effective patient education. Regulatory frameworks for paraoptometry typically emphasize the importance of patient safety and the technician's role in supporting the optometrist's care plan, which includes thorough instruction on lens management. An incorrect approach would be to provide generic contact lens care instructions without considering the specific lens material or the patient's individual needs. This fails to address potential incompatibilities between lens types and cleaning solutions, or to highlight risks specific to certain wear schedules, thereby compromising patient safety and potentially violating professional standards of care. Another incorrect approach is to delegate the entire responsibility of contact lens education to the patient without adequate verification of understanding or offering opportunities for questions. This abdicates the technician's duty to ensure comprehension and adherence to safe practices, which is a core component of their role in supporting the optometrist. Finally, an incorrect approach is to recommend over-the-counter cleaning solutions or practices not explicitly approved by the lens manufacturer or the prescribing optometrist. This can lead to lens damage, inadequate disinfection, and increased risk of ocular infection, directly contravening guidelines for safe contact lens management and potentially violating regulatory requirements for scope of practice and patient safety. Professionals should approach such situations by first identifying the specific contact lens type and the patient's prescribed wear schedule. They should then consult the lens manufacturer's guidelines and the optometrist's specific instructions. Patient education should be interactive, allowing for questions and confirmation of understanding. The decision-making process should prioritize patient safety, adherence to regulatory requirements, and the ethical obligation to provide accurate and effective care. Question 9. Governance review demonstrates a paraoptometric technician is performing a routine eye examination. The patient, in a hurry, states, "Just get it done quickly. I don't want any fuss about my eyes." The technician observes a noticeable difference in the size of the patient's pupils' anisocoria. The technician is aware that accurate documentation of pupillary responses is crucial for the optometrist's assessment. What is the most appropriate course of action for the paraoptometric technician? Option A. Insist on a prolonged pupillary examination to thoroughly assess the anisocoria, disregarding the patient's stated desire for a quick examination. Option B. Politely inform the patient that all observed findings, including pupillary size differences, must be accurately documented for the optometrist's review and proceed to document the anisocoria. Option C. Document the pupillary response as normal, assuming the anisocoria is a benign finding the patient is accustomed to. Option D. Omit the observation of anisocoria from the patient's record to expedite the examination and avoid causing the patient further concern. The correct answer is B. Politely inform the patient that all observed findings, including pupillary size differences, must be accurately documented for the optometrist's review and proceed to document the anisocoria. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the paraoptometric technician's duty to provide accurate and comprehensive care within their scope of practice, as defined by the Certified Paraoptometric Technician (CPT) regulatory framework. The technician must navigate the ethical imperative to respect patient autonomy while upholding professional responsibilities related to patient safety and accurate diagnostic information. The potential for misinterpretation or incomplete information regarding the patient's pupillary responses, particularly concerning anisocoria, necessitates careful judgment. The correct approach involves politely but firmly explaining the necessity of documenting all observed pupillary findings, including any asymmetry, to the optometrist. This upholds the CPT's responsibility to gather objective data essential for diagnosis and treatment planning. The regulatory framework for CPTs emphasizes accurate data collection and reporting as a cornerstone of patient care. By ensuring all observations are documented, the technician fulfills their ethical obligation to contribute to a complete and accurate patient record, which is vital for the optometrist's clinical decision-making and for patient safety, especially when pupillary abnormalities could indicate underlying neurological or ocular conditions. This approach respects the patient's desire for a quick examination while prioritizing the integrity of the clinical assessment. An incorrect approach would be to simply ignore the observed anisocoria to appease the patient's desire for a swift examination. This failure violates the CPT's duty to accurately record all relevant clinical findings. The regulatory framework mandates thoroughness in data collection, and omitting a significant observation like anisocoria could lead to a delayed or incorrect diagnosis by the optometrist, potentially compromising patient health. Another incorrect approach would be to proceed with documenting the pupillary response as normal without noting the asymmetry, even if the patient expresses no concern. This constitutes falsification of patient records, a severe ethical and regulatory violation. The CPT is bound by principles of honesty and integrity in their professional conduct. A third incorrect approach would be to dismiss the patient's concern about the examination duration and insist on a more extensive pupillary assessment than is clinically indicated at that moment, without first attempting to gather the necessary data. While thoroughness is important, an overly rigid or dismissive demeanor can erode patient trust and is not aligned with the professional standard of patient-centered care. The goal is to balance efficiency with comprehensive data collection. The professional decision-making process in such situations should involve 1. Acknowledging the patient's stated preference or concern. 2. Assessing the clinical necessity of the observation in question. In this case, documenting pupillary findings is standard. 3. Politely and clearly communicating the professional requirement for accurate documentation, explaining its importance for the optometrist's assessment. 4. Performing the necessary observation and documentation efficiently and professionally. 5. If the patient continues to express significant distress or resistance, seeking guidance from the supervising optometrist. Question 10. Assessment of a patient's needs for new spectacle lenses reveals they are experiencing significant glare from headlights at night and are concerned about eye strain from prolonged computer use. They also mention a desire for a modern look and are interested in lenses that are lightweight. Based on these stated needs, which of the following approaches best guides the paraoptometric technician in recommending appropriate lens materials, coatings, and designs? Option A. Focus on recommending the most budget-friendly lens material and design, explaining that advanced coatings are often unnecessary for typical daily use. Option B. Advise the patient that glare and eye strain are common issues not significantly impacted by lens choice and recommend standard plastic lenses with a basic anti-scratch coating. Option C. Suggest polycarbonate lenses due to their impact resistance, a scratch-resistant coating to protect the lenses, and a single-vision lens design as it is the most straightforward option. Option D. Recommend high-index lenses for their lightweight properties, an anti-reflective coating to reduce glare and eye strain, and a progressive lens design to offer a modern aesthetic and address potential near-vision needs. The correct answer is D. Recommend high-index lenses for their lightweight properties, an anti-reflective coating to reduce glare and eye strain, and a progressive lens design to offer a modern aesthetic and address potential near-vision needs. Explanation. This scenario presents a professional challenge because a paraoptometric technician must balance patient needs and preferences with the practical limitations and regulatory guidelines surrounding spectacle lens selection. The technician's role is to facilitate informed decision-making, ensuring the chosen lens material, coating, and design are not only suitable for the patient's visual needs and lifestyle, but also comply with any applicable standards for optical dispensing. The challenge lies in translating a patient's subjective experience and desires into objective, appropriate lens recommendations within the established framework of optometric practice. The correct approach involves a thorough assessment of the patient's visual requirements, lifestyle, and any specific concerns, followed by an explanation of how different lens materials, e.g., polycarbonate high-index coatings, e.g., anti-reflective scratch-resistant, and designs, e.g., single-vision bifocal progressive can address these needs. This approach is justified by the ethical obligation to provide competent and patient-centered care, ensuring the patient understands the benefits and drawbacks of each option. It aligns with the CPT's responsibility to assist the optometrist in delivering optimal visual outcomes and patient satisfaction, adhering to professional standards of practice that prioritize patient well-being and informed consent. An incorrect approach would be to recommend a lens material or design based solely on cost or ease of dispensing, without considering the patient's visual acuity, refractive error, or lifestyle. This fails to meet the patient's specific needs and could lead to suboptimal vision, discomfort, or dissatisfaction, violating the ethical duty of care. Another incorrect approach would be to dismiss a patient's request for a particular lens feature, e.g., a specific type of progressive lens, without a valid clinical or regulatory reason, potentially limiting their choices and undermining their autonomy. Furthermore, recommending a lens material or coating that is not approved or recognized for its safety and efficacy within the relevant regulatory framework would be a significant ethical and professional failure. Professionals should employ a decision-making process that begins with active listening to the patient's concerns and preferences. This should be followed by a comprehensive evaluation of their visual needs and refractive data. The technician then educates the patient about suitable lens options, explaining the advantages and disadvantages of each in relation to their specific situation. This education should be clear, concise, and free of jargon, empowering the patient to make an informed choice in collaboration with the optometrist. The final decision should be a shared one, ensuring the patient feels heard and confident in their selection. Question 11. Upon reviewing the visual fields and optic nerve imaging of a patient diagnosed with primary open-angle glaucoma, the paraoptometric technician notes a slight but measurable increase in optic nerve pallor since the last examination. The patient, when asked about their adherence to prescribed eye drops, expresses frustration with the daily regimen and states, "I'm tired of these drops. I think I'll just stop using them." As a certified paraoptometric technician, CPT, operating under U.S. regulations, what is the most appropriate immediate course of action? Option A. Advise the patient that discontinuing their medication will likely lead to irreversible vision loss and strongly encourage them to continue the prescribed regimen. Option B. Agree with the patient's frustration and suggest they try stopping the drops for a week to see how they feel. Then report back to the optometrist. Option C. Immediately document the patient's statement and report it to the supervising optometrist without engaging the patient further, as treatment cessation is a clinical decision. Option D. Gently explain to the patient the progressive nature of glaucoma-related optic nerve damage and the critical role of consistent medication in preserving vision. Then document the conversation and inform the supervising optometrist of the patient's expressed desire to discontinue treatment and the discussion held. The correct answer is D. Gently explain to the patient the progressive nature of glaucoma-related optic nerve damage and the critical role of consistent medication in preserving vision. Then document the conversation and inform the supervising optometrist of the patient's expressed desire to discontinue treatment and the discussion held. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the paraoptometric technician's duty to uphold professional standards and patient well-being. The technician must navigate the delicate balance of respecting patient autonomy while ensuring that decisions are informed and do not compromise the patient's ocular health, particularly when dealing with potentially progressive conditions like glaucoma. The core of the challenge lies in the technician's role as an extender of the optometrist's care, requiring them to act within their scope of practice and ethical obligations. The correct approach involves a commitment to patient education and collaborative decision-making within the established scope of practice. This approach prioritizes informing the patient about the implications of their choices regarding optic nerve health and treatment adherence. By clearly and empathetically explaining the progressive nature of glaucoma-related optic nerve damage and the importance of consistent management, the technician empowers the patient to make a more informed decision. This aligns with ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their care, while also adhering to the regulatory framework that mandates technicians to support optometrists in patient care and education. The technician's role is to facilitate understanding, not to make unilateral decisions about treatment cessation. An incorrect approach would be to immediately dismiss the patient's request or to proceed with the patient's wishes without further exploration or education. This fails to uphold the duty of care by not ensuring the patient fully understands the potential consequences of discontinuing treatment for a condition that causes irreversible optic nerve damage. Ethically, this could be seen as a failure of beneficence, as it may lead to preventable vision loss. From a regulatory standpoint, it could be interpreted as exceeding the technician's scope of practice by making a clinical judgment about treatment cessation without direct optometrist involvement or adequate patient counseling. Another incorrect approach would be to simply report the patient's request to the optometrist without any attempt at patient education or understanding the underlying reasons for the patient's desire to stop treatment. A reporting is necessary. Failing to engage the patient in a discussion about their optic nerve health and treatment adherence misses a crucial opportunity for patient support and education. This approach neglects the technician's role in reinforcing treatment plans and addressing patient concerns, potentially leading to a breakdown in the patient-optometrist relationship and suboptimal management of the glaucoma. Finally, an incorrect approach would be to pressure the patient into continuing treatment against their expressed wishes. While the technician's intention might be to protect the patient's vision, this approach infringes upon patient autonomy. It can erode trust and create an adversarial relationship, making the patient less likely to engage in future care. The technician's role is to educate and support, not to coerce. The professional decision-making process for similar situations should involve a structured approach. First, actively listen to and understand the patient's concerns and reasons for their request. Second, within the scope of practice, provide clear, empathetic, and accurate information about the condition, its progression, and the importance of the prescribed treatment for preserving optic nerve health. Third, collaborate with the supervising optometrist to discuss the patient's wishes and develop a joint plan for further patient education and management. Fourth, document all interactions and discussions thoroughly. This process ensures that patient autonomy is respected, while professional responsibilities and ethical obligations are met. Question 12. The risk matrix shows a patient reporting significant discomfort with their current spectacle prescription, yet objective refraction measurements indicate a stable and accurate prescription. The paraoptometric technician is faced with a decision on how to proceed. Option A. Inform the patient that their measurements are stable and their complaint is likely unrelated to the prescription, and proceed with no further action. Option B. Document the patient's complaint and the objective findings, and then consult with the supervising optometrist to discuss the discrepancy and potential next steps. Option C. Record the patient's subjective complaint but take no further action, as the objective measurements are within normal limits. Option D. Immediately adjust the spectacle prescription based on the patient's reported discomfort, assuming their subjective experience is the primary indicator of need. Correct answer is B. Document the patient's complaint and the objective findings, and then consult with the supervising optometrist to discuss the discrepancy and potential next steps. Explanation. This scenario presents a professional challenge because it requires the paraoptometric technician to balance patient comfort and satisfaction with the accurate and ethical delivery of optometric care. The technician is aware of a potential discrepancy between the patient's subjective experience and the objective measurements, creating a conflict between immediate patient relief and the long-term health of their vision. Careful judgment is required to ensure that any intervention is both appropriate and ethically sound, adhering to professional standards and patient well-being. The correct approach involves clearly communicating the findings to the supervising optometrist, explaining the discrepancy between the patient's reported comfort and the objective refractive data. This upholds the paraoptometric technician's responsibility to accurately record and report findings, and to escalate complex or potentially problematic situations to the licensed practitioner. This aligns with ethical principles of patient care, which prioritize accurate diagnosis and treatment, and regulatory guidelines that define the scope of practice for paraoptometric technicians, emphasizing their role in assisting the optometrist and ensuring patient safety. An incorrect approach of immediately adjusting the prescription based solely on the patient's subjective complaint, without further investigation or consultation with the optometrist, fails to adhere to the principle of evidence-based practice. It bypasses the diagnostic process and could lead to an incorrect prescription, potentially causing further visual discomfort or even harm. This also violates the regulatory framework by exceeding the paraoptometric technician's scope of practice, which typically requires supervision and authorization for prescription adjustments. Another incorrect approach of dismissing the patient's subjective complaint because the objective measurements appear normal is also professionally unacceptable. While objective measurements are crucial, patient-reported symptoms are vital indicators of visual function and comfort. Ignoring these symptoms can lead to patient dissatisfaction and a failure to identify underlying issues that might not be fully captured by standard refractive tests. This approach neglects the holistic aspect of patient care and the importance of patient-reported outcomes. Finally, an incorrect approach of documenting the patient's complaint but taking no further action or discussion with the optometrist is a failure of professional responsibility. While documentation is important, it is insufficient when a potential clinical issue is identified. The paraoptometric technician has a duty to ensure that all relevant clinical information is brought to the attention of the supervising optometrist for appropriate evaluation and management. The professional decision-making process in such situations should involve a systematic approach. First, accurately gather all objective data, refractive measurements. Second, attentively listen to and document the patient's subjective complaints. Third, identify any discrepancies between objective findings and subjective reports. Fourth, consult with the supervising optometrist, presenting all findings and concerns clearly and concisely. Fifth, follow the optometrist's instructions for further investigation or management. This process ensures that patient care is both thorough and ethically compliant. Question 13. Performance analysis shows that a patient in their mid-40s is experiencing increasing difficulty with near-vision tasks, such as reading small print. They express concern about this change. As a certified paraoptometric technician, CPT, what is the most appropriate way to address their concern regarding the mechanism of this visual change? Option A. Tell the patient that this is a common issue and there is nothing that can be done about it. Option B. Inform the patient that they are simply getting older and will likely need reading glasses soon. Option C. Recommend a specific brand and power of over-the-counter reading glasses that might help. Option D. Explain that the lens inside the eye becomes less flexible with age, reducing its ability to change shape and focus on close objects, a condition known as presbyopia. The correct answer is D. Explain that the lens inside the eye becomes less flexible with age, reducing its ability to change shape and focus on close objects, a condition known as presbyopia. Explanation. This scenario is professionally challenging because it requires a paraoptometric technician to accurately assess and explain a common age-related visual change to a patient, ensuring the explanation is both medically sound and ethically delivered within the scope of practice. The technician must avoid overstepping their boundaries while providing essential information that empowers the patient to understand their visual condition and treatment options. Careful judgment is required to balance providing helpful information with the need for a comprehensive examination and diagnosis by the optometrist. The correct approach involves clearly and concisely explaining the physiological mechanism of accommodation and how it changes with presbyopia, using understandable language. This approach is ethically justified as it aligns with the paraoptometric technician's role in patient education and support, as outlined by the Certified Paraoptometric Technician (CPT) certification guidelines, which emphasize patient understanding and informed consent. By focusing on the mechanism and the natural progression of presbyopia, the technician provides valuable context for the patient's visual symptoms without making a diagnosis or prescribing treatment, which are the optometrist's responsibilities. This fosters patient trust and facilitates a more productive discussion between the patient and the optometrist. An incorrect approach would be to simply state that the patient needs reading glasses due to age, without explaining the underlying physiological changes. This fails to educate the patient about the mechanism of their vision loss and may lead to a superficial understanding of their condition, potentially causing anxiety or confusion. It also misses an opportunity for proactive patient education, which is a key component of quality patient care. Another incorrect approach would be to suggest specific lens powers or types of reading glasses. This constitutes practicing optometry without a license and is a direct violation of regulatory frameworks governing allied health professionals. It undermines the optometrist's role and could lead to inappropriate visual correction, potentially harming the patient's vision or causing discomfort. A third incorrect approach would be to dismiss the patient's concerns by stating that vision changes are a normal part of aging and nothing can be done. This is ethically unsound as it fails to acknowledge the patient's experience and neglects the availability of effective management strategies for presbyopia. It also demonstrates a lack of empathy and professional responsibility to provide accurate and helpful information within the scope of practice. The professional reasoning process for similar situations involves first understanding the patient's chief complaint, and then determining what information can be ethically and accurately provided within the paraoptometric technician's scope of practice. This includes explaining physiological processes and common conditions in an accessible manner. It is crucial to recognize the boundaries of one's role and to defer diagnosis and treatment recommendations to the licensed optometrist. Effective communication, patient education, and adherence to ethical guidelines are paramount. Question 14. Implementation of a comprehensive eye examination reveals a patient experiencing sudden, painless loss of vision in their left eye. During the examination, the paraoptometric technician observes significant retinal pallor and a distinct cherry red spot at the macula. Considering the blood supply to the eye, which of the following actions best reflects the paraoptometric technician's responsibilities and scope of practice in this critical situation? Option A. Immediately refer the patient to an ophthalmologist for urgent evaluation and management. Option B. Attempt to administer a topical anesthetic and dilating drop to assess the posterior pole further. Option C. Advise the patient to rest their eyes and return in 1 week for a follow-up examination. Option D. Document the findings and schedule the patient for a routine dilated fundus examination at their next available appointment. The correct answer is A. Immediately refer the patient to an ophthalmologist for urgent evaluation and management. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a paraoptometric technician to interpret and act upon subtle clinical findings that directly relate to the eye's vital blood supply. Misinterpreting these findings or failing to recognize their significance could lead to delayed or inappropriate patient care, potentially impacting vision. The technician must demonstrate a thorough understanding of ocular anatomy and physiology, specifically the ophthalmic artery, central retinal artery, and choroidal circulation, and how their compromise manifests clinically. This requires not just memorization, but the ability to apply knowledge in a practical, patient-centered context, adhering strictly to the scope of practice defined by CPT regulations. Correct approach analysis. The correct approach involves recognizing that a patient presenting with sudden, painless vision loss, particularly in one eye, and exhibiting signs suggestive of compromised blood flow to the retina, e.g., retinal pallor, cherry red spot, strongly indicates a potential occlusion of the central retinal artery or a significant issue within the ophthalmic artery's branches. This necessitates immediate referral to an ophthalmologist for urgent evaluation and management. This approach is correct because it aligns with the CPT's defined scope of practice, which emphasizes patient safety and timely referral for conditions beyond the technician's diagnostic or treatment capabilities. Prompt referral ensures that the patient receives specialized medical attention to potentially restore vision or mitigate further damage. A critical ethical and regulatory imperative. Incorrect approaches analysis. An incorrect approach would be to attempt to manage the situation independently by prescribing medication or suggesting home remedies. This is a regulatory failure as it exceeds the CPT's scope of practice, which does not permit independent medical treatment. Ethically, it places the patient at risk by delaying definitive care from a qualified physician. Another incorrect approach would be to dismiss the symptoms as minor or age-related without further investigation or referral. This is a failure in professional judgment and potentially a breach of the standard of care. The CPT has a responsibility to recognize and report significant clinical findings, and sudden vision loss is a critical sign that demands immediate attention. As per guidelines on patient assessment and referral, a third incorrect approach would be to document the findings but delay referral until the next scheduled appointment or until the patient's symptoms worsen. This is a critical ethical and regulatory failure. The urgency of potential vascular occlusions requires immediate action to preserve vision. Delaying referral in such a critical situation demonstrates a lack of understanding of the potential severity of the condition and a failure to prioritize patient well-being, which is a core tenet of professional conduct and regulatory compliance. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and adheres to regulatory scope of practice. This involves 1. Thoroughly assessing the patient's reported symptoms and observed clinical signs, correlating them with known ocular anatomy and physiology, particularly concerning the blood supply to the eye. 2. Identifying any findings that fall outside the technician's scope of practice or indicate a potentially emergent condition. 3. Consulting relevant CPT guidelines and protocols for patient management and referral. 4. Acting decisively to ensure appropriate and timely referral to the ophthalmologist when emergent conditions are suspected, documenting all findings and actions meticulously. Question 15. Which approach would be most professionally appropriate for a certified paraoptometric technician when a patient reports difficulty seeing clearly in dim lighting conditions and with glare, and the standard visual acuity test appears normal? Option A. Proceed with a complete contrast sensitivity test to objectively assess the patient's ability to discern variations in luminance. Option B. Advise the patient that since their visual acuity is normal, their symptoms are likely subjective and do not require further testing. Option C. Perform a brief, informal assessment of contrast perception without using standardized charts or protocols. Option D. Document the patient's subjective complaints and defer any further testing to the optometrist's discretion without performing any objective contrast assessment. The correct answer is A. Proceed with a complete contrast sensitivity test to objectively assess the patient's ability to discern variations in luminance. Explanation. This scenario presents a professional challenge because it requires a paraoptometric technician to balance the immediate need for efficient patient care with the ethical and regulatory obligation to ensure accurate and comprehensive testing. The technician must recognize that a patient's subjective report of visual difficulty, even if seemingly minor, warrants thorough investigation. Failing to perform a complete contrast sensitivity test when indicated could lead to an incomplete or inaccurate diagnosis, potentially impacting the patient's quality of life and the effectiveness of any prescribed treatment. The challenge lies in prioritizing patient well-being and adherence to professional standards over expediency. The correct approach involves performing a complete contrast sensitivity test as indicated by the patient's symptoms and the clinical context. This aligns with the CPT's responsibility to assist the optometrist in providing high-quality eye care. Regulatory frameworks and ethical guidelines for paraoptometric technicians emphasize the importance of accurate data collection and patient assessment. Performing the full test ensures that subtle visual deficits, which may not be apparent with standard acuity charts, are identified. This comprehensive approach supports the optometrist's diagnostic process and upholds the standard of care expected of certified professionals. An incorrect approach would be to dismiss the patient's complaint of difficulty seeing in dim light or with glare without further investigation. This failure to perform a complete contrast sensitivity test, when indicated by the patient's subjective experience, violates the principle of thorough patient assessment. Ethically, it prioritizes speed over patient needs, potentially leading to misdiagnoses of conditions that affect contrast sensitivity, such as early cataracts, glaucoma, or neurological issues. This also falls short of the regulatory expectation for paraoptometric technicians to conduct tests that provide meaningful diagnostic information. Another incorrect approach would be to perform only a partial or abbreviated contrast sensitivity test, perhaps due to time constraints or a belief that the patient's symptoms are not significant. This is ethically problematic as it compromises the integrity of the testing process and the reliability of the data provided to the optometrist. It also fails to meet the regulatory requirement for performing diagnostic tests accurately and completely. The patient may not receive the full benefit of the examination, and the optometrist may be working with incomplete information. A further incorrect approach would be to rely solely on the patient's self-reported symptoms without objective testing. While patient history is crucial, it must be corroborated by objective findings. Failing to conduct the contrast sensitivity test when the symptoms suggest its necessity means that the paraoptometric technician is not fulfilling their role in objective data gathering. This can lead to misinterpretations of the patient's visual status and potentially delay appropriate management, which is a failure in both ethical patient care and regulatory compliance. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's presenting complaints, the clinical context, and the scope of practice for a certified paraoptometric technician. When a patient reports symptoms that are commonly associated with reduced contrast sensitivity, e.g., difficulty with glare, poor vision in low light, trouble distinguishing subtle differences in shades, the technician should recognize this as an indication for contrast sensitivity testing. Adherence to established protocols and a commitment to thoroughness, even when time is a factor, are paramount. If there is any doubt about the necessity or proper execution of a test, consulting with the supervising optometrist is always the appropriate course of action. Question 16. The analysis reveals that a patient's spectacle prescription, intended for a standard vertex distance of 12 mm, has been measured with a vertex distance of 16 mm during the dispensing process. The prescription includes a sphere power of -6.00 diopters. Considering the importance of vertex distance in spectacle prescriptions, what is the most appropriate course of action for the paraoptometric technician? Option A. Inform the patient that the measured vertex distance is different and advise them to return to the prescriber for a new prescription. Option B. Adjust the lens power by adding +0.25 diopters to compensate for the increased vertex distance without consulting the prescriber. Option C. Consult with the prescribing optometrist or ophthalmologist to discuss the measured vertex distance and its potential impact on the lens power, seeking clarification or a revised prescription if necessary. Option D. Proceed with dispensing the lenses as prescribed, assuming the difference in vertex distance is negligible and will not significantly affect the patient's vision. The correct answer is C. Consult with the prescribing optometrist or ophthalmologist to discuss the measured vertex distance and its potential impact on the lens power, seeking clarification or a revised prescription if necessary. Explanation. The analysis reveals a scenario where a paraoptometric technician is tasked with verifying a spectacle prescription for a patient with a significant difference in vertex distance between the measurement taken and the standard assumed by the lens laboratory. This situation is professionally challenging because an incorrect vertex distance can lead to inaccurate lens power, potentially causing visual discomfort, asthenopia, or even inducing unwanted refractive error, impacting patient vision and satisfaction. The technician must exercise careful judgment to ensure the prescription is accurately dispensed according to the prescriber's intent and patient needs, adhering to professional standards of care. The correct approach involves recognizing the discrepancy in vertex distance and understanding its impact on the effective power of the spectacle lens. The technician should consult with the prescribing optometrist or ophthalmologist to confirm the intended vertex distance or to obtain a revised prescription if the measured vertex distance significantly alters the lens power. This ensures that the dispensed spectacles accurately reflect the refractive correction needed by the patient, aligning with the ethical obligation to provide competent and safe patient care, as outlined by Paraoptometric technician practice guidelines, which emphasize accuracy and patient well-being. An incorrect approach would be to proceed with dispensing the lenses based solely on the original prescription, without accounting for the measured vertex distance. This fails to acknowledge the optical principles that dictate how vertex distance affects lens power, particularly for higher prescriptions. Ethically, this constitutes a failure to exercise due diligence and could lead to patient harm or dissatisfaction, violating the principle of beneficence. Another incorrect approach would be to arbitrarily adjust the lens power without professional consultation. This bypasses the prescriber's authority and expertise, potentially leading to an incorrect refractive correction and violating the scope of practice for a paraoptometric technician. Finally, ignoring the discrepancy altogether and dispensing as is, without any verification or consultation, demonstrates a lack of professional responsibility and a disregard for patient safety and the accuracy of the prescribed correction. Professionals should approach such situations by first identifying the discrepancy. Then they should consult relevant professional guidelines and, crucially, communicate with the prescribing eye care professional to clarify any ambiguities or potential impacts of the discrepancy. This collaborative approach ensures patient safety, adherence to the prescriber's intent, and the highest standard of care. Question 17. Process analysis reveals that during a routine visual field screening, a certified paraoptometric technician, CPT, observes a distinct and consistent pattern of visual field loss in the superior temporal quadrant of the patient's left eye. The patient reports no subjective symptoms. The CPT is aware that such a defect can be indicative of various neurological or ocular conditions, but their training has focused on operating the equipment and recognizing gross abnormalities, not on interpreting the specific etiology of visual field defects. The CPT is faced with deciding how to proceed with this finding. What is the most appropriate course of action for the CPT in this situation? Option A. Document the observed visual field defect precisely as recorded by the equipment and immediately report the finding to the supervising optometrist for their evaluation. Option B. Record the finding but wait until the end of the day to report it to the supervising optometrist, as there are other patients waiting. Option C. Inform the patient that the observed defect is likely a minor anomaly and not a cause for concern, as they are asymptomatic. Option D. Attempt to explain to the patient that the defect might be related to a problem with their optic nerve and advise them to schedule a follow-up appointment with a neurologist. The correct answer is A. Document the observed visual field defect precisely as recorded by the equipment and immediately report the finding to the supervising optometrist for their evaluation. Explanation. This scenario presents a professional challenge because it requires the paraoptometric technician to balance the patient's immediate comfort and perceived needs with the ethical and regulatory obligations to provide accurate and complete information to the supervising optometrist. The technician's role is to gather objective data and report it faithfully, not to interpret complex visual field findings or make diagnostic assumptions. The potential for misinterpreting a visual field defect could lead to delayed or incorrect diagnosis and treatment, impacting patient care. The correct approach involves meticulously documenting the observed visual field defect as per standard protocols and immediately reporting these findings to the supervising optometrist without attempting to explain or diagnose the cause. This aligns with the CPT's scope of practice, which emphasizes data collection and technical assistance, not independent clinical interpretation or diagnosis. Regulatory frameworks for paraoptometric technicians, such as those outlined by the American Optometric Association, AOA, for certified technicians, emphasize the importance of accurate record keeping and prompt communication of findings to the optometrist. Ethically, this approach upholds the principle of beneficence by ensuring the patient receives timely and appropriate professional evaluation, and non-maleficence by avoiding the risk of misdiagnosis or delayed care due to the technician's premature interpretation. An incorrect approach would be to dismiss the observed anomaly as insignificant or a temporary fluctuation. This fails to meet the regulatory requirement for thorough data collection and reporting. Ethically, it violates the duty of care to the patient by withholding potentially critical information from the supervising clinician, which could lead to harm. Another incorrect approach would be to attempt to explain the visual field defect to the patient, suggesting possible causes or prognoses. This exceeds the paraoptometric technician's scope of practice, which is strictly limited to technical and supportive roles. Such actions could lead to patient anxiety, misinformation, and interfere with the optometrist's diagnostic process. Regulatory guidelines for CPTs clearly define their responsibilities and prohibit them from engaging in independent diagnosis or patient counseling on medical conditions. A further incorrect approach would be to document the finding but delay reporting it to the optometrist, perhaps due to personal workload or uncertainty. This constitutes a failure in professional communication and adherence to established protocols for patient care. Prompt reporting is crucial for timely intervention and diagnosis, and any delay, regardless of the reason, can be detrimental to patient outcomes and violates the ethical imperative of acting in the patient's best interest. The professional decision-making process in such situations should involve a clear understanding of one's scope of practice, adherence to established clinical protocols, and a commitment to open and immediate communication with the supervising clinician. When encountering findings that are outside the technician's interpretive capabilities or that suggest a potential deviation from normal, the default action should always be to accurately document and report to the optometrist for their professional assessment. Question 18. Operational review demonstrates a paraoptometric technician consistently obtains slightly different lens power readings when measuring the same spectacle lens on two different lensometers within the practice. The technician has not yet reported this observation to the supervising optometrist. What is the most appropriate immediate course of action for the technician to ensure patient care and practice integrity? Option A. Immediately adjust the prescription based on the average of the two readings without further investigation. Option B. Re-verify the lens measurements using a different lensometer, and if the discrepancy persists, consult with the supervising optometrist. Option C. Discard the initial readings and attempt to estimate the correct lens power based on visual inspection. Option D. Record the initial reading from the first lensometer and proceed with dispensing the spectacles as per the prescription. Correct answer is B. Re-verify the lens measurements using a different lensometer, and if the discrepancy persists, consult with the supervising optometrist. Explanation. This scenario presents a professional challenge because it requires the paraoptometric technician to identify and address a potential discrepancy in lensometry readings that could impact patient care and practice efficiency. Technician must exercise sound judgment to determine the most appropriate course of action, balancing accuracy, patient safety, and established protocols. The correct approach involves re-verifying the lens measurements using a different lensometer, and, if the discrepancy persists, consulting with the supervising optometrist. This is the best professional practice because it prioritizes accurate patient data, which is fundamental to providing appropriate optical correction. The Certified Paraoptometric Technician, CPT, certification implies adherence to professional standards that mandate meticulousness in diagnostic procedures. Re-verification ensures the integrity of the measurements before they are used for prescription or dispensing. Escalating the issue to the optometrist is crucial, as it falls within the scope of practice for the supervising clinician to make final decisions regarding prescription accuracy and patient management when discrepancies arise. This aligns with ethical obligations to provide competent care and maintain professional accountability. An incorrect approach would be to simply record the initial reading without further investigation, assuming the first measurement was correct. This fails to uphold the professional standard of accuracy and could lead to dispensing incorrect lenses, negatively impacting the patient's vision and potentially causing harm. It also bypasses the implicit duty to ensure the reliability of diagnostic data. Another incorrect approach would be to immediately adjust the prescription based on the initial reading without re-verification or consultation. This demonstrates a lack of critical thinking and an overreach of the paraoptometric technician's scope of practice. The CPT role is to gather accurate data and assist the optometrist, not to unilaterally alter prescriptions. This action could lead to dispensing an incorrect prescription and undermines the optometrist's authority and responsibility. A further incorrect approach would be to discard the initial reading and attempt to guess the correct measurement without a systematic re-verification process or consultation. This is unprofessional and arbitrary, lacking any basis in established procedure or evidence. It introduces an element of guesswork into a precise diagnostic process, compromising patient care and the credibility of the practice. The professional reasoning process for similar situations should involve a systematic approach. First, ensure the accuracy of the measurement through re-verification using calibrated equipment. If a discrepancy persists, escalate the issue to the supervising optometrist for their expert assessment and decision-making. This process ensures patient safety, maintains professional integrity, and adheres to regulatory expectations for paraoptometric practice. Question 19. Cost-benefit analysis shows that providing comprehensive patient education on astigmatism and its management options, including spectacles, contact lenses, and refractive surgery, is crucial for patient satisfaction and adherence to treatment plans. As a certified paraoptometric technician, CPT, which of the following actions best aligns with regulatory requirements and ethical practice when a patient inquires about these management strategies? Option A. Provide a brief overview of astigmatism symptoms and state that management options are solely decided by the optometrist, without further explanation. Option B. Strongly recommend refractive surgery as the most advanced and permanent solution for astigmatism, as it offers long-term benefits. Option C. Explain the optical principles of astigmatism and how spectacles, contact lenses, and refractive surgery address it, emphasizing that the optometrist will make the final determination on the most suitable option after a thorough examination. Option D. Discuss the potential complications of each management option in detail, including risks and recovery times, without the optometrist present to answer specific medical questions. The correct answer is C. Explain the optical principles of astigmatism and how spectacles, contact lenses, and refractive surgery address it, emphasizing that the optometrist will make the final determination on the most suitable option after a thorough examination. Explanation. This scenario is professionally challenging because it requires the paraoptometric technician, CPT, to balance patient education, ethical considerations, and the scope of practice within the regulatory framework governing optometric care. The CPT must ensure the patient receives accurate and understandable information about their astigmatism and management options, while also recognizing the limitations of their role and when to defer to the optometrist. The correct approach involves the CPT accurately explaining the optical principles of astigmatism, including how it affects vision, and the common management strategies. This includes detailing how spectacles correct astigmatism by compensating for the irregular corneal shape, how contact lenses achieve this through their own shape or toric design, and the general concept of refractive surgery as a permanent correction method. The CPT must then clearly articulate that while they can provide this information and assist with lens selection under the optometrist's supervision, the final prescription and decision-making regarding treatment options rest with the licensed optometrist. This aligns with the CPT's role as an assistant to the optometrist, providing patient education and support within defined parameters, ensuring informed consent and patient understanding without overstepping professional boundaries. This approach upholds ethical standards by promoting patient autonomy through education and respecting the optometrist's ultimate responsibility for patient care. An incorrect approach would be for the CPT to recommend a specific type of management, such as strongly advocating for refractive surgery over spectacles or contact lenses, without the optometrist's direct involvement in the recommendation process. This constitutes practicing optometry without a license, as the determination of the most appropriate management strategy for astigmatism requires a comprehensive eye examination and clinical judgment by a licensed optometrist. This failure to adhere to the scope of practice is a direct violation of regulatory guidelines and ethical principles, potentially leading to patient harm and professional disciplinary action. Another incorrect approach would be for the CPT to provide only a superficial explanation of astigmatism, focusing solely on the symptoms without detailing the underlying optical cause or the mechanisms by which different management options work. This would fail to adequately educate the patient, hindering their ability to make informed decisions in consultation with the optometrist. Ethically, this is a disservice to the patient, as it does not fulfill the CPT's responsibility to facilitate understanding. A third incorrect approach would be for the CPT to dismiss the patient's questions about management options, stating that it is not their job to know or that they don't deal with that. This demonstrates a lack of professional engagement and a failure to provide necessary patient support. While the CPT may not make the final decision, they are expected to be knowledgeable enough to explain options and facilitate the patient's understanding of the optometrist's recommendations. This approach erodes patient trust and undermines the collaborative nature of eye care. The professional decision-making process for similar situations involves 1. Understanding the patient's question and underlying concern. 2. Accessing and recalling accurate, up-to-date information about the condition and its management options. 3. Explaining the information clearly and concisely, using appropriate terminology. 4. Identifying the boundaries of the CPT's scope of practice and knowing when to involve the optometrist. 5. Ensuring the patient feels heard, understood, and empowered to participate in their care decisions. Question 20. System analysis indicates a patient presents with a chief complaint of sudden onset foreign body sensation and sharp pain in the left eye, which began after gardening. The patient reports tearing and photophobia. Upon examination, the cornea appears clear to the naked eye, but the technician notes the patient is squinting and blinking frequently due to discomfort. Based on the Certified Paraoptometric Technician (CPT) regulatory framework, what is the most appropriate course of action? Option A. Reassure the patient that the cornea appears clear and advise them to return if symptoms worsen significantly, as there is no immediate visual threat. Option B. Advise the patient to use over-the-counter artificial tears liberally and monitor symptoms, as it is likely minor irritation from gardening debris. Option C. Attempt to stain the cornea with fluorescein and prescribe antibiotic eye drops to prevent infection, as the symptoms suggest a corneal abrasion. Option D. Document the patient's symptoms and findings, and recommend the patient schedule an appointment with the optometrist for further evaluation and management of a suspected corneal abrasion. The correct answer is D. Document the patient's symptoms and findings, and recommend the patient schedule an appointment with the optometrist for further evaluation and management of a suspected corneal abrasion. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a paraoptometric technician to interpret subjective patient symptoms and correlate them with objective clinical findings, specifically concerning the cornea. The technician must differentiate between a potentially serious condition requiring immediate referral and a less urgent issue that can be managed with conservative care. Misinterpretation could lead to delayed treatment, patient discomfort, or even vision loss. The technician's role is to gather and present information accurately, but also to recognize when their scope of practice is exceeded, and professional judgment dictates escalation. Correct approach analysis. The correct approach involves recognizing the signs and symptoms suggestive of a corneal abrasion, which is a break in the epithelial layer of the cornea. This condition, while often treatable, carries a risk of infection and can lead to significant discomfort and visual impairment if not managed appropriately. The regulatory framework for Certified Paraoptometric Technicians, CPT, emphasizes the importance of accurate data collection, patient symptom reporting, and recognizing when a condition warrants the attention of a licensed eye care professional. Therefore, documenting the patient's complaint of foreign body sensation and pain, noting the presence of a potential epithelial defect on examination, and recommending follow-up with the optometrist or ophthalmologist aligns with the CPT's responsibilities. This ensures the patient receives a definitive diagnosis and appropriate treatment plan from a licensed practitioner, adhering to the principle of patient safety and professional scope of practice. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's symptoms as minor irritation and advising over-the-counter artificial tears without further investigation or referral. This fails to acknowledge the potential severity of a corneal abrasion, which can worsen or become infected without proper diagnosis and management. Ethically, this approach prioritizes expediency over patient well-being and deviates from the CPT's duty to ensure patients receive appropriate care. Another incorrect approach is to attempt to diagnose and prescribe treatment for the suspected corneal abrasion. This directly violates the scope of practice for a CPT, which does not include diagnosing medical conditions or prescribing medications. Such an action would be a breach of regulatory guidelines and could have serious legal and ethical repercussions. A third incorrect approach is to ignore the patient's subjective complaints and focus solely on objective findings that appear normal, such as a clear cornea on gross examination. This overlooks the possibility of subtle epithelial defects that may not be immediately apparent without specific staining or magnification, and it fails to validate the patient's reported discomfort, which is a critical component of clinical assessment. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and adheres to their defined scope of practice. This involves 1. Thoroughly documenting patient-reported symptoms. 2. Performing objective clinical assessments within their training and certification. 3. Correlating subjective and objective findings. 4. Recognizing signs and symptoms that indicate a condition requiring referral to a licensed eye care professional. 5. Communicating findings clearly and concisely to the supervising practitioner. In this case, the combination of foreign body sensation, pain, and the possibility of an epithelial defect necessitates referral for definitive diagnosis and management.